to introduce Brad, and is it Cannell? Is that right?
It's Cannell, but
Cannell. Okay.
everyone says Cannell. And so what I always say is I'm pretty sure I'm the one who's saying it wrong at this point, but it's Cannell like channel without the H.
Okay. Yeah, there you go. I said it right. All right. Brad Cannell. He is an epidemiologist at one of the largest health science centers in the world, where he uses data-driven approaches to improve the lives of older adults and the health of the communities they live in. That sounds like such an idealistic way to be. And Brad, tell us what an epidemiologist is to start with.
Does anybody know? I bet somebody here knows, right? Stephanie, you know?
No,
Stephanie
I just moved. Oh. No, I don't
Are
know.
you, do you and Dr. Fauci do the same thing?
No, he's an MD, but I mean, so there's a lot of epidemiologists on his staff, I'm sure. Yeah. So it's the study of the distribution and determinants of diseases at the population level. So who gets sick and why, or who stays healthy and why. But I specifically focus, I don't do much infectious disease work at all. You know, there's a good chance that many of you here know more about infectious disease than I do. So I focus on chronic diseases, and in particular, diseases or conditions that affect the well-being of older adults.
Excellent. All right. Well, thank you for that. And some of you may have heard at the beginning, before the introduction, I was asking Brad how he liked presenting to a screen full of initials, and he prefers our faces. So let's get those cameras on and get ready to chat your questions in when he has his question break. All right, Brad, the floor is yours. Oh, look at that. Already a question. Yes, you absolutely can have his contact information.
Yeah.
I don't know if you have it at your presentation or if you want me to send it out, but I'm happy to.
Yeah, we can do either one. I have like my name in here, but I don't think I have my email or anything, but I can send it out, or you can send it out, or whatever.
Sure.
Yeah, and I love to see faces, even if you're obviously like checking your email while I'm talking or whatever. That's okay. It's still less eerie than still staring at like a blank screen. So, all right, I will get started. Nope, wrong screen. Let's try again. All right, I think that's better. Can everybody see the slide?
Sorry, I was yes, there's your slide. I was copying your info so I could drop it in the chat.
Perfect. Okay, so ChatGPT came up with this title. I hope you guys like it. Lone Star Synergy, Collaborative Approaches to Elder Justice in Texas. First of all, thanks. Good afternoon, and thanks for being here, or having me here to facilitate this little chat today. And I say chat because I hope it's not a talk. I hope I'm not just talking at you the whole time. I hope we get some interaction, and I hope it's a little bit more fun. First, maybe. There we go. Yeah, I'm Brad. I'm currently an associate professor in the McGovern Medical School's Joan and Stanford Alexander Division of Geriatric and Palliative Medicine. It's a mouthful, but I guess when you give like a bunch of money to a university, then everybody at the university is required to say your name every time they talk. And that's at UT Health Houston. However, I live here in Fort Worth, and I'm happy to tell you how that all came about if you're ever interested. I also have joint appointments in the School of Public Health and the Cizik School of Nursing. That's also a long story, but the takeaway is I have too many bosses, so don't do that to yourself. But I also have a passion for healthy aging and late life quality of life. And that passion for me goes way back further than my foray into academia. And perhaps that's why Dana asked me to come and facilitate a discussion about how academia can help other organizations in the coalition. Or maybe I'm reading too much into the invitation. Who knows? We'll see. first of all, just to kind of get a lay of the land, I'd like to know, or I'd be interested in knowing if there's any other academics in the audience. Anybody or recovering academics that would be you count too? No? Okay, cool.
I thought I saw Susanna jump on.
Oh, is she on?
Yeah, she's on.
Okay.
I see her. She's smiling.
All right.
There.
Yeah,
Cool.
my wife taught for a little while, and then she ended up doing consulting instead.
She's smart. Yeah, it's probably a much better way to go. Okay, so before I go too much further, I also want to acknowledge that I can't do my job effectively at all without strong partnerships in the community, including some of you, sitting in this room right now. Lynn, looking at you, we've worked together a lot over the years. And so given that, and because most of today's audience represents the non-academic, side of the equation, I've been asked to focus on how academia can support your work, as I said earlier. But I want to acknowledge that it's a two-way street, and there's so much that you and your organizations can do to help us in academia. And if anyone feels inspired to share, their experience, in the opposite direction, helping academia or enlightening me on what I may not fully understand or appreciate about that side of the street, please bring it. I welcome it. I'm all ears. Okay, with that said, I don't claim to have any particular expertise in the area of collaborations in general or specifically between academia, community organizations, and industry, but I have been around a little bit. And I do find this topic interesting. And so just to give you a little flavor of what I mean by I've been around a little bit, prior to my first academic position, I held positions at the Louisville Metro Health Department, the Northern Kentucky Health Department, the Florida Office on Disability and Health, and then I was an officer in the United States Army Medical Service Corps. I was an environmental science officer for like eight years or so. So I have some experience outside of academia as well. So hopefully that boosts my credibility with you all a little bit. Further, I try my best to stay involved in community groups and coalitions like this one, which is where I've gotten to know several of you, not all of you, unfortunately, but several of you over the years. And so the Fort Worth Safe Communities Coalition, which no longer exists, or they meet without me and don't tell me one or the other, is particularly near and dear to my heart because it's where the biggest project I manage got its start. So at one of these coalition meetings, we were trying to figure out the burden of elder mistreatment in our community. And so I think most of us know or have at least heard at some point that the nationally around 10% or so, probably as a floor minimum, of older adults experience elder mistreatment nationally each year. But in one of our coalition meetings, we really wanted to know what proportion of older adults experience elder mistreatment here in our community specifically. So, Lynn, you were probably at this meeting, and maybe some others of you too. This was back, like I said, in 2013, I think. So we started asking each other just who around the table might have data or has data that might point us in the right direction, right? And these are some of the organizations that were represented there. I'm probably missing some there as well. And so MedStar was one of those organizations, and they came back to the next meeting and they said, in the last year, we responded to 911 calls for about 30,000 older adults. And, we just said that at least 10% nationally are experiencing mistreatment every year. So, that means at least 3,000 of those older adults were likely living with elder mistreatment. But they officially only reported 23 cases. And this was pretty severe underreporting. And to their credit, they said the same thing. This is pretty severe underreporting or likely underreporting. And so we began discussing how we could create it how we could address that underreporting. And from that discussion, the Detection of Elder Abuse through Emergency Care Technicians project was born. And so I'm not going to go into, I have many presentations I can give about Detect, but that's not really the topic here, so I'm not going to go into it too much. But I will say that this program, in partnership with MedStar and the Texas Department of Family and Protective Services, we've screened more than 100,000 older adults in North Texas and helped connect thousands of them with resources they otherwise may not have received. And so we're pretty proud of the work that has happened through this program that happened as a result of a coalition meeting and a discussion that came out of that coalition meeting. So of course, the human impact of the tech is our most important metric of success. And one human sort of impact metric I just gave you is the number of people's lives we've touched. But another one, and because this is a session about how academia can benefit some of the organizations represented in this room, it's worth pointing out that the DETECT project has received 3 rounds of grant funding so far, totaling almost $8 million. And a large portion of that money was paid back to our collaborators in the form of subcontracts to help contribute to the research project. But in some cases, their contribution to the research project was sort of doing things they already do, just maybe gathering more data about how they're doing it so that we can evaluate it or something like that, right? The exception is APS. You guys won't even let us buy you Chick-fil-A or something. Like, it's really hard to give money to APS. but yeah, MedStar has been a great partner, and others of you have been a great partner in this. So I'm not sure how many of you, Nicholas, you may know, I know that your wife worked in academia, and I think there was someone else who's from academia. But many of you may not know that I'm required in academia to cover 50% of my salary every year with grant funds. So I have to go out and get a grant or combination of grants every year that will pay up to 50% of my salary or more, actually, to do research, right? And that isn't universally true at every institution, and the percentage of the salary that needs to be covered can vary from place to place. But many academics have similar requirements, particularly those like at health science centers like UNT Health Science Center or UT Health, where I'm at. Probably UTA has some. And so it means that we typically have a lot of motivation to help with grant writing. So I guess my first question is here, how many of you work for organizations that can receive grant funds or subcontract funds from grants to assist you do work or to evaluate work, or, you know, just as sort of additional opportunities to collaborate on improving the lives of older adults? Yeah. Nicholas, sorry. I guess yeah isn't helpful. Nicholas. Did you raise your, oh, you just raised your hand to like say me. Okay, no follow up there. Yeah, okay. So that's sort of the first thing is that I wanted to point out was that for many of us in academia, grant writing is like, you know, if I'm feeling really cynical, I say I don't do science, I'm a salesperson and I sell ideas to the federal government for a living, right? That's what my organization pays me to do. Luckily, I care about the science too. And so, but for some of you, like, take advantage of that, right? I think many of you might work in organizations where those grants could be helpful. Partnering with academics is a great way to get help on grants, or I hope it is. All right. Sorry. Isn't it so uncomfortable when you see yourself on Zoom? The other screen. All right, here we go. All right, next slide. All right. Additionally, the DETECT project has given rise to multiple publications like these. Our team members have been invited to speak at numerous conferences and events, and our team members have been interviewed by mass media outlets. We've been on a couple of radio shows and things like that. And again, you may or may not know that I am in fact required to publish at least 6 journal articles a year and demonstrate my ability to disseminate our research findings out to the world. And so why am I saying this? I'm saying this because academics are also typically, they typically have a lot of motivation to help with disseminating messages to the public And most of us have to develop at least some skill in that because, again, it's part of what we're evaluated on every year. So how many of you work for organizations that would value new opportunities to raise public awareness about your organization and the work that your organization is doing? So I see a couple hands. Yeah, great. So this is yet potentially another area where you might want to partner with academia. And then in addition to grant writes, I thought that was going to take a lot longer than it did. Oh well, this very rarely do I not talk long enough, but we can spitball. I got lots of questions here. Okay, so in addition to grant writing and fundraising support and public awareness and education, here are some other common ways that academia can assist your organization. So research and data analysis. Many of us are big data nerds, and we have students that are big data nerds. And you can, sharing data can sometimes be tricky, but we can usually get it done. You know, we've got all the HIPAA compliance servers and the, you know, all the things. And so we can create data use agreements and memorandums of understanding, and we can usually get that done. And then we can help with research and data analysis, which helps us have pilot data for grants or published papers. So we're usually highly motivated to help with research and data analysis. Capacity building and training. So one of the big things we did with the Detect project was instead of hiring our own sort of internal team of graduate assistants to go do follow-up interviews with older adults that we had screened, we paid for a training protocol for MedStar to use to train some of their medics to do that for us. And so what did that do? That returned more of the funds back to MedStar. And instead of just having these graduate assistants that would then graduate and go on, you know, training them with these skills, and then they graduate and go on with their life, we've put that capacity, that training back to work in our community. I've also done trainings for Dallas County Public Health, for Tarrant County Public Health, so we can help and do training and build capacity in various different ways. Program development and evaluation, really, most of the time, these are just two different words to say, you know, research study and data analysis. But in certain situations, one works better than the other, or one set of terms works better than the other. Regardless, we can generally help with program evaluation and program development and evaluation. Access to resources. That can be a lot of things, you know, computing power, and you know, if you need to work with patients, we have a medical school, we have a hospital system, we have EMR data, but the big one really is students, right? Like, I think a lot of people here are working in organizations that probably have tight budgets, and I think even organizations that don't have tight budgets think they have tight budgets. And so one thing that we can generally help with is sending students your way, and you know, they are what they are, they're still learning. And sometimes it doesn't go as well as we would all like, but oftentimes people will tell me that our students end up being just fantastic. They go on to hire them. You know, it can be a great asset to you more often than not if you get into the habit of working with academic institutions to bring in student workers. And there's lots of different avenues to do that. Policy development and advocacy. So we have people that study policy development and advocacy, but we also have, like, our university employs a whole office of people that just go to Austin every year and advocate for things, right? And so we can help or partner with you on things like that. I know a lot of you guys do advocacy as well, but we may have resources that would be helpful or promote the good work that you're already doing. And then long-term partnerships. It's usually any academic institution that's worth its salt has a vested interest in trying to create win-win partnerships with the community. And then over the long run, that can spin off this whole list of other things that hopefully will be helpful to you. Okay, so with that, I'm going to stop talking. And Dana, do I have time for like a discussion, or should I just call it? Is that it?
Oh, go for it. You can have a
Okay.
discussion.
All right,
See
perfect.
what great ideas come out.
All right. So I guess just to kick it off, like, do any of these resonate with you? Is there anything I'm missing? Is there any questions that you have about any of these?
I have a question.
Yeah.
If you want to establish a new contact with, you know, an academia, who would be, what office or who would be the right person to connect with?
Good
Or
question.
position, or like,
Yeah. That's a great question. So I think that, first of all, you can reach out to me if you want. But it's interesting how we all work for the university, but at least every university I've ever worked at, we also kind of operate like our own little small business within the university. And so in many cases, if you can find somebody that's doing work that you're particularly interested in, or they have a skill set that you think might be particularly useful, I think it's fine to just go ahead and reach out to them directly, maybe even preferable to go ahead and reach out to them directly. But I could imagine how it might be hard to figure out who's there and what they do. If you know that you want to work with somebody in medicine, you can reach out to the medical school. You just go on the website and ask for like the dean's office, for example, not the dean, but the dean's office, and they can probably put you in touch with somebody in faculty affairs or with the associate dean for research, and they should be able to tell you, okay, here's, you're interested in elder mistreatment. Brad Cannell over in Fort Worth does elder mistreatment. Let's put you in contact with him or something like that. If you don't even know which school to start with, all universities, I think, have a media relations department. And I don't think you have to be with the media to just contact them and say, hey, I'm interested in this, that, or the other topic. And they won't know the answer more than likely, but they can dig for it and find it for you. Susanna, is there anybody else you can think of that people should contact if they're just sort of cold calling?
That's a that's a hard question. I think university sometimes, there's so many levels. So oftentimes I think when we're out working in communities, like these coalitions and things like that, that's where the partnerships are formed, like-minded people gather and then are able to talk about common interests and foster these relationships. So I don't know if it's cold calling. I think you named all the ones that are viable. One thing I'd like to add to your presentation is that, oftentimes are in a academic setting, sometimes we're not as nimble as nonprofits, and so some of these funding opportunities, these partnerships with nonprofits and community organizations can really leverage the strengths of both organizations. And if you guys are the lead and we're able to come out along and help, it could streamline the application process. So it's, the academics do not always have to be the lead.
It's a great point, Susanna. Thank you. And there are some grants that specifically forbid universities and academic institutions from applying. There are some grants that will only allow academic institutions and universities to apply. So there's a little mix of both out there.
Thank you.
Yeah, absolutely. It's never a good sign when nobody has questions. Never a good sign.
I have a self-serving question, Brad.
Yeah.
It's Lynn.
Yeah.
We have some potential funding. Call it potential because it's not signed off on yet, but we included funding for a student. Could I let you know when that comes through? Could you possibly connect us with it would be financial exploitation of older adults would be the work that they would be doing, and it would be data collection.
Yeah, absolutely. I'd be happy to.
Okay, thank you.
Yeah, you're welcome. Okay. I mean, I'm happy to answer questions. If this really isn't helpful, I don't want to waste anybody's time. But it's totally fine for us to move on. But if anybody it doesn't sound like anybody's burning up with questions. But if anybody does has questions, or if there's anything you need, or any way I can be helpful, I think Dana put my contact information in the chat. Please reach out to me, and I'd love to help to the extent that I can.
I'll confirm it with Lynn, but I'm pretty sure. That's
Thanks,
not-
Brad.
Mhm.
Brad Cannell.
That's right.
I do have a question, but it's not related to the great info you gave us. That should give us food for thought. We'll probably have more questions later. But what's the most interesting thing about financial exploitation that you've learned recently that you may not have known before?
Financial exploitation specifically?
Yeah, anything? I put you on the spot.
So, well, I'm a nerd, and so this really isn't subject specific, but I recently was at a talk where I saw some really cool uses of predictive analytics and large language models to sift through millions and millions of rows of data from the U.S. Postal Service to try to find predictors for financial exploitation, and they had some pretty interesting results. And yeah, just the way that they were using these models, and having done a little bit of that kind of analysis myself, and really struggled with pushing that much data through models or whatever was really interesting to me to see that they had done that.
Yeah. Wow, that's awesome. Very cool. It looks like Nicholas has a question, maybe?
Yeah, I just wanted to know if you could elaborate a little bit on the scale of the DTECT program or organization and what that looks like.
The scale in terms of like
personnel, or just to get an idea of, is that a small group of a couple people? Is this a large, just some frame of reference for that?
Yeah, no, great question. So we have a pretty lean team. It's me, we have a program manager, we have a biostatistician, we have 3 or 4 GRAs who kind of rotate in and out of the project. I have a couple of co-investigators, and that's about it. But the lion's share of the data collection, again, I'm a big fan of, and research doesn't always work this way, but I try not to hire people internally to do research. I try to, again, build capacity in the community. So when we were doing this with EMTs and paramedics, EMTs were doing all of the data collection. Now we're doing this with home-based primary care. Our home-based primary care docs and mid-level providers and social workers are doing all the data collection. And we're providing some financial compensation for that, and we're providing training and other things. But for me, that just feels like a more sustainable model. It feels like a model where we're putting resources back into the organizations that are doing the on-the-ground work every day. And I feel better about that for whatever reason. And it feels like a model where, hopefully incorporating the community into the research helps it have a broader impact than just sort of doing the research over here off to the side and then coming to you guys and being like, look what we figured out, right? So I'm constantly, and there's this whole like kind of research called community-based participatory research, and like I'm sure many of you heard of it, and I'm not an expert, and I don't know or claim to be doing that. Maybe I am by accident, but just like the idea of just like we partner with the community organizations and the community and the patients and the participants as much as we possibly can and still remain, scientifically rigorous is the approach that we always take. So our internal team is pretty lean, it's pretty small, but our partners, 50, 100, I don't know. A lot of people have touched. No, if you count every medic that's done this or whatever, it's, several hundred. So a lot of people have been involved in the process.
That's great. Thank you.
Yeah.
Very cool.
Hey, I have a
Awesome.
question. Oh, I'm sorry. Did I interrupt
Go for it,
somebody?
Pat. No, go for
Okay.
it, Pat.
Brad, I'm really curious about this post office research that you mentioned. Is there anything out there yet in the literature on that? Or what are the predictors that they're using to, do you have a recall on
Yeah,
that?
gosh, this was a little bit ago, and I don't remember like the main, like I said, I just got all nerdy about the methods. I don't remember what the main like end result was.
Okay.
But I can remember that the researcher who was doing the work is named Marty DeLima, and she's at the University of Minnesota. And if you're interested in financial exploitation, she's doing some of the best research specifically in financial exploitation of anybody I'm aware of. And that's really probably the type of elder mistreatment that we touch the least in our studies. My studies, because my studies are all observation based, and I can get into a whole thing about that, but it's pretty hard typically to observe financial exploitation from the outside, right?
Yeah.
So yeah, if you want more information about that or financial exploitation in general, I highly recommend Marty DeLima.
Okay.
I wish I could tell you how to spell that, but I can't.
I kind of sounded it out.
Yeah.
Which university, Brad?
I'm pretty sure at the University of Minnesota. University of Minnesota. It's either Minnesota or Wisconsin. Somewhere where they eat cheese curds and drink beer a lot.
That would be Wisconsin.
We'll find her.
We'll find her. All right.
Yeah.
Because I'm interested in
Sounds
that.
good.
I'm interested in that data too.
Okay, we'll find her. Sounds good. Thank you again, Brad. Very, very, very good information. We